Uganda Yellow Fever Preventive Mass Vaccination Campaign Phase 2 is scheduled for 2nd April to 8th April 2024. Uganda is a yellow fever endemic country with high risk of transmission, hence the introduction of a routine vaccine immunization since October 2022 during the Integrated Child Health Days. However, despite the introduction of the yellow fever vaccine in the routine immunization schedule, national coverage has remained low at 29%, hence posing high risk of yellow fever outbreaks. In April 2024, the Ministry of Health, in collaboration with the Global Alliance for Vaccines, Gavi, the World Health Organization, the United Nations Children's Fund UNICEF, and various partners, will carry out Phase 2 of the Yellow Fever campaign in 53 districts and cities across the 5 regions of Uganda. These regions include Moroto, which is Karamoja, Mbarara, which is Ankole, Kampala, Masaka, which is South Central, and Soroti, which is Teso region. Following this activity, Archbishop of Church of Uganda, His Grace the Most Reverend Dr. Stephen Kazimba Mugaru, has encouraged Ugandans to embrace the vaccination exercise and avoid contracting yellow fever.
The key benefit of yellow fever vaccination is that a person gets one injection for lifetime protection. One injection for lifetime protection. Take note of that.
Dr. Kazimba says that yellow fever is a very dangerous disease. However, it can be prevented through vaccination.
Yellow fever is transmitted through the bite of an infected mosquito, and the following are the signs and symptoms: rapid onset of fever, abdominal pain, diarrhea, vomiting, general body weakness, yellowing of the eyes, loss of appetite. When you are beginning to lose appetite, take care. And bleeding from any body openings. Yellow fever is a dangerous disease, but can be prevented through vaccination with the yellow fever vaccine.
Adds that religious leaders should work with the Ministry of Health to mobilize their congregation to participate in vaccination exercise.
Appeal. The Ministry of Health appeals to religious leaders to mobilize their congregation to participate in the yellow fever preventive mass vaccination campaign in places of worship and at functions such as weddings in the community. So if you are whispered to, or if you are led to have an injection before you go for a party after the wedding, you just accept.
Meanwhile, Minister of State for Kampala, Honorable Chofatogabe Kabuye, also urged the public to embrace the vaccination, adding that it is a mandatory requirement for those wishing to travel outside Uganda.
Yellow vaccination. Dear Ugandans, this is already a challenge we have with us, and those who remember when we were still young, we used to experience this disease used to attack us, and mostly you could see your child turning yellow, your eyes and everything, including susu. But government, as usual, because of its urge to say that its people live a healthy life as enshrined in the Constitution of Uganda, I think Article 20, Article 80 and Article 20, where people have got rights to good health, government, as usual, engaged in the massive vaccination of all its citizens, especially against these other diseases, and including now yellow fever, not forgetting COVID-19 and others. And those who want to travel, you know, most of the countries, you can't even get a visa without presenting evidence.
He adds that yellow fever vaccination has no negative effect.
I'm telling you, I took one 10 years ago. It's about to expire, and I'm going to take another one. You see, 10 years ago, I'm still alive. I had 2 kids within the span of 10 years ago. So don't attach some bit of excuses. You will produce, you do everything, you'll be fine. Men, you'll be fine. You understand when I say men, you'll be fine. So you can take on this vaccination.
Joram Oititi, a representative from the rubber export industry, emphasizes the potential consequences of not having yellow fever vaccination for individuals seeking better opportunities abroad. He urges them to prioritize their health and participate in this essential exercise.
It's actually sometimes it's frustrating some people, because you are supposed to fly, you are in the airport, and then you don't have a yellow fever card and you can't cross airport, and it's expensive. I think airport is more than 100,000 if you go to the airport to get it from airport. I think it's more than 100,000. I want to encourage all the Ugandans, and I want to let you know that once you're vaccinated, your vaccination card takes 10 years, so you can keep it and stay with it for 10 years. And also it's good for your health. Once you're vaccinated, then you can fight other diseases. Not also about the cards also.
Julius Momuza, Church of Uganda Family TV, News at 8.